Hi, good afternoon, everyone. Thank you so much for joining us. My name is Greer Kelly. I am Assistant Director of Development for the Batten School. And welcome to Leadership Learned in Crisis, Experiences from Military and Medicine. It is my pleasure to introduce Batten friend and advisor, Jameson Norton. Jameson is president of Vanderbilt Psychiatric Hospital and Outpatient Services, as well as more recently as Chief Administrative Officer for COVID-19 Alternative Care Sites in Middle Tennessee. Prior to his career in healthcare, Jameson served 7 years as a Marine infantry officer, including 2 deployments overseas. For distinguished action, he was awarded 2 Navy and Marine Corps Commendation Medals, the Army Achievement Medal, and the Colonel Bull Fisher Award for recognition as a top infantry officer in his battalion. Jameson is an active volunteer in his community and a member of multiple civic and professional boards. He holds an MBA from Vanderbilt's Owen Graduate School of Management, and especially important to us, is a 2006 graduate of the University of Virginia. I'm going to turn the floor over to Jameson for a few minutes, and then we'll be taking questions via the Q&A feature.
Well, greetings. Thank you so much, Greer. What a joy it is to be with you today. Thank you for having me, Greer, Olivia, Millie, and all the Batten leadership team. I'm so grateful for the opportunity to bring these conversations together. We all have such an important role to play in our current COVID crisis, and it means a lot to me to have a chance to take a deep breath and just find renewed strength in being together in a group like this. I am learning more every day about myself, my family, and our hospital amid this crisis, and we're going to get through this together. As a community and nation, I've seen us at our best when the needs around us are greatest. And I'm so thankful and humbled to really have the opportunity to serve alongside America's best, the most committed, courageous, compassionate, competent service members, first responders, and caregivers who are wired to make things better for people and provide hope amid this uncertainty. I feel that our mission and purpose have become more clearly defined amid this adversity. And I'm confident that incredible breakthroughs will come from this pandemic because of the caliber of people that we have across this great country. Greer, next slide. I wanted to share just a brief summary of what led me here. Greer shared a little bit about my background, but growing up in Nashville, 9/11 happened my senior year of high school, and my brother and I decided to join the military together. My most formative years preparing for crisis leadership might very well have been honing mission tactics and 5-paragraph orders on O Hill in Charlottesville in the Marine NRTC program. After UVA, I spent time with the 2nd Battalion, 4th Marines as an infantry officer on 2 deployments where both were Marine expeditionary units, where we served as the 911 force for certain regions in the world, where we had special training in a wide range of mission profiles, but really didn't know what country we would be in or what language we might be speaking. It leads you in this crisis mindset of preparing for whatever contingency might come next. And after that, I ended up I had a chance to lead Marine recruiting for Tennessee on a B billet, and then transitioned to business school at Vanderbilt, which really started a very difficult journey of finding my next mission and purpose after transitioning from active duty. I remember at Vanderbilt Business School, we had a chance to do a healthcare career immersion program in which I had a chance to spend a shift in the emergency room at Vanderbilt on a Friday night. As odd as it might sound, as soon as I arrived, I remember just that beautiful feeling that I was home, that these were my people. And I watched trauma patients arrive in great need and fantastic teams responding in perfect harmony, providing life-saving care, and their teamwork was inspiring. I loved how each member of those teams really shared the same passion and took the same oath and were intrinsically motivated and had a deep desire to make a difference in the world. And as they looked to their left and right, they could count on each other. And I love that idea that the community was counting on them 24/7. This is something familiar to me from the Marines and high stakes leadership. and when lives are on the line. And there's so many parallels between the military and healthcare, and as both are just such a people and mission-oriented business. Since that night, I've dove right into healthcare and 100%, and haven't looked back since. Fast forward a few years, I had an opportunity to lead a hospital in Tampa with a company called Acadia Healthcare, and founded the core military program, which is focused on post-traumatic growth and recovery. And then I came back to Nashville and have been leading behavioral health services for Vanderbilt University Medical Center. Next slide, please. At Vanderbilt, we have a full continuum of behavioral health care, including a hospital for all ages, psychiatric emergency space, intensive outpatient programs, school-based programs, and even street psychiatry or homeless health services. I absolutely love what we do and the people that we get to work with. Next slide. One of my favorite parts is the broad platform that we have for improving health and outcomes across the state in the Vanderbilt Health Affiliated Network, in partnership with over 62 hospitals at this point, even beyond the 53 on the slide. We get to, we'll get more into this, but as some of you might expect, the most pressing issue among these affiliates has been mental health needs in their communities. Together, we build a better system of care, and we collaborate to find solutions for each region of the state. Next slide. So between military and healthcare, I've been attracted to higher stress environments, which whether it's the declining life expectancy, as you see here, most notably due to suicide and overdose, next slide, or to address the current COVID crisis. Each is a highly dynamic and environment, and elements of surprise and uncertainty. Next slide, Greer. And in reality, these environments are constantly changing, full of confusing situations, friction, and complex problems. So I think it's the people that really draws me in the most about it. I love studying the human factors and how people respond and bond together and overcome periods of stress and hardship. I believe, as I've heard before, that 10% of life is what happens to you. The other 90% is how you respond. And I do believe that the mark of a great leader is how you respond under stress and whether others can rely on you in those defining moments. I've found that success in these moments of crisis comes from the hours of preparation, the knowledge and values, the trust built among your team, and the habits of action, the resilience that you have formed really through past adversity. At this point, the latest crisis has brought me here. This is the Music City Center in downtown Nashville, all 1.2 million square feet of it. Late Friday afternoon on April 3rd, as I was getting ready for a nice relaxing weekend, I got a call from my boss, the CEO at Vanderbilt and the commissioner for the Department of Health, on a call that just asked me, will I be willing to serve as the chief administrative officer for this COVID alternative care site located at the Music City Center. That was to be 1,600 beds total. And next slide, I can show you the layout for what those beds look like. And, really, over the course of several days and working with Army Corps engineers, National Guard, many leaders from across this system of care that we have in healthcare, we devised a plan that would be able to care for the patients in our community, assuming that there was going to be a surge. And fortunately, we saw a flattening of the curve in Nashville and have since relocated our alternative care site to numerous locations that have a longer lease and a smaller bed footprint than this. But when I want to talk through the experience of that and really what are the essential components of effective leadership in a crisis. I'm going to walk you through a few key principles and can tell you that the lessons learned from these, both success and failure, were in my time in the Marine Corps. Because they're very honed in on crisis and being prepared for it. Next slide. And the first of those is brilliance in the basics and cohesive teamwork. Training your people as a team, knowing each other's strengths and weaknesses with trust and discipline is essential for holding together in a crisis where every person has to count. Often in these high stress environments, we go back to our brainstem thinking, where only what is rigorously trained and maintained to the level of habit will be accessible. It takes time and energy for a team to mold together in a way that can automatically respond with trained instinct. Remember that, as an essential tenet, that your team will fight the way that they have been trained, whether you like that or not. I love the quote from this great military strategist, Clausewitz, many of you are aware of, but he said, habits harden the body for great exertions and strengthen the heart in great peril. They fortify the judgment against first impressions. Habits breed the priceless quality of calm. Next slide. The next one is the 80% solution. So leaders must get comfortable making decisions and giving orders without exact information. I remember from business school, the most challenging issue, and by far among the majority of my classmates, was dealing and making decisions amid uncertainty and ambiguity. I found that my veteran classmates and I really didn't have that problem. For us, the landscape had always been changing. We had experienced what has now become known as the 3-block war, where we can have humanitarian aid, full-scale combat, and peacekeeping operations all within 3 blocks of each other. And the more complex that mission is, the more simple and concise our orders need to be, and how we communicate, and the way that we function. We've built, and it's important to build a mental model for combat or for any industry in order to screen out the noise and distill the volumes of information quickly in order to make decisions in a timely manner. Next slide. So the other 20% of the plan is made possible by small unit leadership and empowerment at the local team level, which requires us as leaders to deliver a mission that has a clear intent or a why. What is your purpose? Also, we need to be able to communicate an end state, a vision of where we're headed. These essential components foster initiative. They enable creativity and decisiveness at the right levels where your people have the information. Local leaders can then adapt quickly to the changing landscape that's really a tenet of a crisis situation. One of the most difficult things that we have to do in a crisis is recognize the moment for making a decision. Each moment allows us to bring in more information, but that may come at a cost of resources or strategic advantage depending on the situation as that time evolves. Next slide.
You want me to go forward?
So the next we'll talk about commitment, and I won't spend a lot of time on it, but I can't understate the importance of resolute commitment to accomplish the mission in a crisis. The leader will likely experience vulnerability and failure at many phases over the course of a crisis, but it requires composure, resourcefulness, and grit to overcome. So many things can help us inspire us through that, but it ultimately comes down to a personal fortitude and grit to keep going in a relentless pursuit of a worthy cause in order to, and in many cases, against great odds. Next slide. So the last one is leadership by example. Especially in a crisis, we need to be authentic and real and caring with genuine concern and accepting unlimited responsibility for the well-being of everyone within our care. It's vital to our success. It takes great passion and love for those around you, which in my mind is a moral imperative of great leadership in general, and certainly in a crisis. People will endure great hardship at personal sacrifice willingly for a great cause if 2 elements of leadership are firmly in place. And I think one is the leader endures that same hardship shoulder to shoulder when able. And the second is front lines understand their why, like we talked about, and are well informed as to why that hardship may be necessary. And this is a paradox for many in a crisis as a leader. In the military, there's a term called the warrior's mask that enables one to function under extreme pressure in combat, and that protects or camouflages the fear and doubt and emotions of the moment in order to lead effectively. This emotional distance can be necessary at times in order to focus on the task at hand in the midst of great human suffering. But it's an extraordinary, difficult balance and can create an internal conflict as we must see to the mission and people under our care while being in tune with our own humanity and aiding the helpless. So some caregivers, for example, in the emergency room can feel a sense of guilt and disappointment in the way that they might have to function in the moment to care for the most critical. And it can feel like an indifference to other suffering, or in reality, but in reality, anything less than that can rob them of energy and time and conviction needed to sustain the mission and to keep others alive. And this is why it's so important to study the effects of this high stress environment and its effects on people to prepare psychologically, emotionally, physically for the great toll that crises can take, and to support them in the over the course of it, and especially in the aftermath. So as I said before, this COVID crisis has taken a tremendous toll, and we're going to learn so much. And I don't think that we know the full extent of that toll at this point. Next slide, group. But we know that there's so many factors at work and how much has been disrupted within our landscape. I want to remind about the social determinants of health, and really how little of a percentage, that 20% at the bottom, that is healthcare related, and so much of it is our health behaviors and our environment and our socioeconomic factors, which have all just been turned on their head. So these are things that we've got to keep a very close eye on, and we know that are going to have a ripple effect over the next many months and years. Next slide. And one thing in particular, as we saw the slide before on the increase in suicides, overdoses, this issue of isolation. We've created physical distancing, and I say physical distancing because there's many ways to engage socially, like we're doing right now. But this, along with a lot of the activities and coping mechanisms and resources in the community that might not be at their full potential right now, makes it a little bit of a challenge and can create more isolation where many were already struggling with it. Next slide. Next slide, yeah. So on this, sorry, one more back on the collaboration. So what it will take is just innovative ways of working together. And it seems chaotic at times, but this is what it takes to collaborate on behalf of our health. And it's just this important reminder that we're all in this together. And our support for each other has never been more important. And I'm continually inspired by how people across the country are so passionate and willing to go out of their way to make things better for other people. There are people out there who need us to show up for them today. As we found time and time again, people will never forget what you did for them in the midst of this crisis. So I'm so thankful for this time together. I really look forward to your questions, and I'll turn it over to you, Greer.
Jameson, thank you so much for sharing all of these lessons with us, and for putting up with me as I skipped all around on your PowerPoint.
You're fantastic. Thank you.
It looks as if we have a number of questions coming in already, so let's get started. Thank you all. So the first question I see here is, in moments of crisis, when you have a big decision, either in the military or in your career now, where do you or did you go for advice, inspiration, and confidence to make a sound decision?
Yeah, that's a great question. And, I do want to stress kind of those moments of calm that are so vital as something, just remember, that moment on that Friday, when it's a very unique mission, one that you're not used to, and that, maybe you haven't studied in a deep way, just having that moment of calm to kind of collect yourself. And, I think, I mentioned that idea that many moments of adversity kind of help prepare you for that. And so obviously those are things that you can't ever study, but that is a time to collect yourself, to think through and really remind yourself you have what it takes. You have been in moments of challenge before and then have overcome. And I think it's just been, when talking about that personal fortitude and the ways that you're going to need that going forward, it's been very helpful to me. But, as far as informing myself, it takes, building a network of people that you can rely on and be able to reach out to. I've spoken to so many different individuals over the course of this period, partly because of the number of agencies, but partly because of just the expertise that they have in their respective areas. So I think fostering that network and knowing, kind of building that list and knowing that you're not expected to know everything, and that reliance on others is a form of humility, but it's also a form of resourcefulness to help overcome whatever that challenge is. And I think that process and framework of that immediate kind of response, there's no perfect science to it. I think we go back to the things that have worked for us in the past, and I think those frameworks are helpful to think through both the people, the networks, the individuals that can help us, as well as our personal commitment and the things that we know are going to give us that calm in the midst of what is a crisis moment, to be able to really get the initial information. And I can't emphasize enough those initial phases of listening, of really absorbing the information that's coming in through many different venues. I like to take notes. I like to try to organize that way and refer back to it to help really make sure that I have that framework. But actually my notes are structured in a way, it's this kind of 5-paragraph order mentality where you have a situation and you've got a mission, and you're really kind of constantly going back to some of those different things to help inform the planning and execution phase of it.
Thank you. I think this next question actually kind of builds on what you were talking about with the network. So have you seen an increase in mental health patients as a result of coronavirus and quarantine? And was your business model set up to handle that, to serve these patients in a time of social distancing, or have you had to change your practices?
Yeah, that's a great question. We've had to change significantly, although there was a lot of foundation building that we had done before coming into this crisis. It was very helpful. Many of you have heard about kind of a silver lining, particularly in healthcare, as being our ability to leverage telemedicine, and improving access to care in venues that really wasn't accessible, even in the home, and using telephonic means and other methods to do this. We have just about every space of our care, every part of the continuum, evolved in different ways, both to make sure of the safety of those spaces, to mitigate those practices and screening, and even now testing initially upon admission. But then within our spaces, inpatient particularly, it has a foundation of group therapy, and so we've got to make sure that we're mitigating any potential spread, and in that we really allow the space to dictate the size of our groups, and we've got to make sure that each of those spaces are as safe as they can be. And so part of that is being prepared with our PPE and training, and we've been able to really onboard the right resources to make sure our staff feel confident in the midst of that environment. But the telemedicine work, particularly in the outpatient setting, and we've done this even in groups, has been really effective. And so we went from about 5% of our care over telemedicine to 88%. So we're still doing some in person, but a lot of it depends on the acuity and the condition of the patients, and the adoption, the availability of the technology, and whether we choose to do that in-person visit, which can still be safe, but for many reasons we want to be able to evolve, to preserve PPE, to make sure that safety and convenience of our patients is at the forefront. And so as far as the need goes, it was interesting. We saw a dip in demand for inpatient services, which traditionally has just been almost overwhelming. Part of that had to do with kind of this elective procedures, which we really don't have on our inpatient front. We didn't limit them at all. But we saw individuals choosing not to come in for their care based on the many, all the information out there. And we've seen that across many forums. I was talking to the chair of our emergency department, who also happens to be the medical director of our fire department for Metro Nashville, and they've seen a 25% increase in cardiac arrest in the home. A lot of this because of you're not seeing a lot of people coming in for care, and they're not, whether they don't feel safe in coming into a hospital environment, or they're just concerned about the implications of it. And so it's important to us to kind of reinforce that safety and make sure that individuals have the right access to care across that continuum. And that's been a period of adoption, both among the patients as well as the providers. But I do believe that this will, in the future, enable improved access to care. Our school-based programs is a great example of one that obviously schools have been out and we've traditionally had a therapist in each of the Nashville city schools. And we've always done some remote or telemedicine support to them in complex cases, but at this point are entirely remote or doing it in the home. But it really helps to inform a little bit more about the environment of these students and helps us to be able to progress some of their care in different ways that we couldn't before. So very hopeful that we'll be able to really take and absorb these learnings and know that the access to care is just at the forefront, particularly as it relates to addressing mental illness. And we want to be really at our potential and be able to use all these different channels to be able to meet those needs. And I think having everyone really more creative and looking at technology and ways that we can solve that problem can go a long way into meeting those needs in the future. At this point, we're seeing an increasing demand for a lot of these mental health services on the inpatient front. We've kind of seen it progress really beyond even what our capacity has been in the outpatient setting, because of telemedicine has really enabled us to do that. But inpatient, we're starting to see this kind of increased need, and I'm sure that many of you have heard some of the reports around caregiver stress, and this has been a priority of ours to make sure that we're proactive in helping to provide the support groups and the channels to be able to enable our frontline caregivers to get the support that they need. We're doing mindfulness sessions twice a day and trying to kind of really enable both education to what we've talked about, as well as support where it's needed at the right timing, knowing that this kind of comes in a cycle.
That's really impressive and comforting that you all are thinking about tackling these problems from multiple different angles. So I wouldn't have thought about many of the things that you just mentioned. It looks as if we've been given approval to go a little bit over to 240, if that works for you.
Absolutely, yeah.
So hopefully we can get through at least a couple more of these questions. So I've got one here from Megan Clancy. She says, you mentioned a key aspect of leadership is providing as much information as necessary for those on the front line to understand that why to their sacrifice. In some of our leadership courses, we have learned that leadership is about disappointing people at a rate they stand, and reading the holding environment to know when to share such information. How have you navigated this balance in a constantly changing environment that has required decisions to be made so quickly?
Yeah, it's a really interesting point. So there's a lot there. Part of it, communication, particularly in a crisis, is so essential. And we didn't go into too much detail, but as you've seen from a lot of our leaders federally, as well as what we're trying to do locally here, whether in an app form or website, it's kind of your source of truth in the midst of the crisis to be able to refer back, knowing how fluid it is. We're getting new research every day. We're changing our practices every day, almost, and keeping up with that and keeping the team well informed, to your point about that frontline ability to absorb that information quickly and be able to respond with the safest approach is essential. And so having that source of truth in a timely way makes a big difference. I also mentioned the idea of authenticity and that genuine, really takes a level of transparency in leadership. I think in our forums, a lot of it came in talking about, how many of our frontline caregivers had COVID, how we are helping to protect them in the midst of what is just an essential part of our mission, that force preservation and making sure that our caregivers are well cared for was absolutely vital. And it was important to make sure that our team was well informed about the status of that and what we're doing to help continue to protect them. So I think just in that vital trust in leadership, that there's a level of transparency there, and that's essential. And then, I mentioned kind of really the simplicity of the order is very important in the midst of a complex environment. And I think those two are different in the sense that we're sharing information, we're being present with each other, and even in our vulnerabilities, we can communicate those things and as a leader. But at the same time, for them to understand what their mission is has to be an essential concept, and it has to have an in order to statement. That why, what is the intent behind what we're doing? Because ultimately that plan is going to be imperfect, and after that first day, it's going to change consistently. And so there's good time spent in planning, but again, there's a level of that 80% solution. We want to be able to move forward. We want to be indecisive about that, and allowing that intent to really make up the rest for the initiative of our own team to be able to do that. And again, that takes individuals who are engaged, who are inspired, who are taking initiative to be able to take the information that they have, which often is better sometimes than what the leader has. So they have information at the front lines about practices that are working and things that are not working that can enable them to make decisions if we have this intent embedded within them. And so I hope that answered your question. Obviously, that's a continuum. It's a balance that we're constantly managing about, what is essential information. We don't want to bombard them with too much information or it feels overwhelming, but at the same time, really those key concepts have to be delivered in a timely manner.
Thank you. So the next question is from Susan Brake, and it is from an educational perspective, what do you think is the most important mental health public relations opportunity, given that many in our country are resisting mask wearing and staying at home?
Yeah, that's a great question. For a long time, we have been advocating, just for mental health parity in a way that really reduces stigma overall. And I think we've made some significant strides in this. And I do believe one of the things that will come from this COVID crisis, I think folks have heard it, over town halls and over streams and media, just folks are more in tune with their own mental health and well-being than they have been. And maybe it's the silence that we all have, experienced in some form over the course of this crisis. A lot of the things that we, sometimes the busy schedules that we once had, or, even just the ways that we, engaged and had many events scheduled and camps and different things, our life becomes a little bit simpler. And so I think there's a more attunement with our own mental health, and I think that will make a big difference. But I do think that making sure that it's held as a priority in a way that with parity to physical health issues is just this essential component that, COVID is just devastated so many, but we will see the trauma from this, just the ripple effect for years to come. And we are obviously, even going into it, we're struggling with social isolation and a lot of the really pervasive issues that have impacted the well-being of our nation. And that really, in the midst of this crisis, we all kind of feel the adrenaline, and we know that we're all kind of oriented on that response. But it's that kind of processing and the aftermath that can be such a challenge, and we've got to be there for each other in the midst of that, and really elevating it and making sure that we need the space. We can't just go back to normal in a way that kind of moves past that processing phase.
This might have to be our last question. Can you please speak a little bit about the strengths and weaknesses of our current healthcare system from your perspective?
Oh, it's a great question.
Not to put you on the spot.
It's a good one, and I think each of our different health systems have our unique challenges. At Vanderbilt, we have just a depth of expertise, and the people are just so committed. But even here, we can struggle with silos and kind of a large, complex, bureaucratic environment at times. And knowing that every person is complex, so they're not coming in with just a psychiatry or mental illness. It's not just a neurological issue, or it's not just a heart condition. We are complex people, and there's such overlap among our different spaces that we work hard to build institutes or really integrated support for care that does it in a way that is caring for the whole person. And I think that really is our biggest challenge, in really not addressing those issues in silos. And sometimes, there's so many different parts of healthcare that have to be somewhat disrupted to be able to do that well. Every form, as you talked about, the care environment, the way that it's reimbursed, the ways that we really perceive our care and train our people. We have residency programs across all different disciplines, and it takes a level of empowerment within those residency programs to know that we're caring for a whole person. And just because we've chosen a discipline that's very specific and unique, a lot of the patient's outcome will be determined by other factors that maybe aren't in their discipline. So that teamwork and the ways that we kind of sometimes just have to work across those angles, and it takes training, it takes new habits, and it takes humility and times to be able to do that well.
Thank you. I'm going to take as much time as they're giving us and give you one final question to end quickly. Can you give an example of good leadership that you've seen in your community or anywhere around the world?
Oh, that's great. Well, I've just been really impressed by Dr. Fauci and Dr. Birx and the ways that they have, really tried to cut through the politics. That they have, really careers of expertise, and you talk about all the different hardships, adversity that we've overcome over the course of many different cycles of epidemics, pandemics that we've encountered, and they've been involved with many of them. And so it gives a level of perspective that I think has been calming for the nation. They've been relentless in just communicating and trying to be consistent about that communication, and really calm, which can be so challenging when encountering so many different opinions and so many people that may be wanting to hear something very specific from them, and kind of really sticking to the evidence around what they're saying. So I've really admired that. I honestly, I've been so proud of our own system. And I think sometimes at Vanderbilt, in a sense that in the crisis, I think we've really been at our best. And I think there's many things that have done, but I think our flattening, which again isn't over, has had a lot to do with really proactive testing early on, really proactive education to help shape the public opinion around the importance of this issue, and then just having that expertise and innovation required when you think about the really acute conditions that can come from this that can enable the best outcomes. And I think we've seen some really great outcomes amid really building early on awareness about the pervasiveness of the illness. Davidson County was very high early on amid really all the southern states. I've got a brother-in-law who's in Alabama, and we were comparing with Kentucky, and I think all these different areas you were seeing less cases, but sometimes it's because the testing really wasn't as apparent, and early on Vanderbilt was doing 80% of the testing for the state, which just took a huge proactive approach, and now it's certainly leveled off to the point where it's become much more consistent. really wherever you go. But that proactive response and saying, whatever it takes, we're going to learn more about this situation. We're going to respond to meet that need because it's part of who we are and it's part of our mission. And I think our team has really resonated with that. So I've been thankful for it. It is always just, it's a constant process. We're learning so much every day and we're constantly in tune with that and really humbled at times, and saying guidance or ways that we were communicating before maybe did or didn't work, and then we're going to try to double back and fix it for the next time. But that constant cycle of improvement has made a big difference. I think we're better prepared because of it.
Thank you, and so much for taking time to spend with us this afternoon, Jameson. Do you have any final comments you'd like to share with the Batten community before we let you get back to work?
I'm just proud to be a part of it. You guys are so impressive in the work that's going on. And I know that we've got students out there, professors, alums. I've got my lawn picture right here in the office. I'm just proud to be part of the team, and thank you for helping to coordinate these conversations that I think all of us really benefit from. So I hope you all have a great day. Stay well. Again, for you leaders in this crisis, you have what it takes, and we believe in you. And thank you for the work that you're doing in so many different areas. Y'all have a great day. Thank you.
Thank you so much.